Hello, my name is Roy Schulte. This video will detail how to conduct a Healthy Hearts cholesterol screening. We will review blood pressure technique, the fingerstick procedure, obtaining a blood sample, and correct paperwork protocol. Let's get started. The first thing you want to do is get your CardioCheck machine ready to go. You want to remove the protective slip here and then insert the batteries into the back of the pack. Fully insert all batteries, then put the back on the machine. Once you have inserted the batteries, you want to make sure the machine is functional. To do this, you will turn on the machine by pressing both buttons simultaneously. The machine will then turn on. From here, you want to use the toggle key, the arrow here, to toggle through the tests until you find Utility. Once you get to the Utility screen, press Enter and it will ask you to check the strip. From here, you can use one of the practice strips and insert it into the machine. Once you see the passed sign, that will mean that the machine is functional and ready to go. Once the machine has passed the utility test, you can then insert the memory chip to make sure it will store the results. Next, make sure your station is properly set up. Here's an example of a properly set up station. The paperwork on the opposite side of the CardioCheck, just so it's kind of out of the way and it won't be interfering with any of the tests that you're going to run with the patient. Once confirmed that the permission form is signed, you can fill out the rest of the paperwork on the screening form here. Make sure that name, date of birth, age, school, and fasting level are all completed. Of important note, make sure the machine number is filled out. Be sure to initial the bottom right-hand corner, and at the top right-hand corner, write the classroom teacher name and the period of the day. Next, we will transition into blood pressure assessments. When taking someone's blood pressure, the first thing you want to do is ensure that you have the right cuff size. You want it to be a snug fit and not too loose. You can generally tell by looking at the person if you need to go with the normal adult, the extra large adult, or the small adult. Have the subject rest one of their arms on the table like so. Take the blood pressure cuff and wrap it around their bicep. Next, put on your stethoscope and place the pad along the brachial artery on the inside of the elbow. When taking a blood pressure, you want to ensure that the back lock is locked. To do so, turn it clockwise all the way until you hear a click. With the pad placed firmly along the subject's brachial artery, slowly release air from the blood pressure cuff. When releasing the air, take note of the first audible sound that you hear and where the needle corresponds to. Also take note of the last audible sound you hear. These two numbers will make up the person's blood pressure. The top number represents the patient's systolic blood pressure, and the bottom number represents the patient's diastolic blood pressure. Next, we will go over fingerstick technique and how to obtain a blood sample for a cholesterol reading. First, you want to put on gloves, and then you can clean off the finger of the patient. Next, you want to clean off the patient's finger. We normally recommend using the non-dominant hand. Just with the band-aid, it will be out of the way a little bit. We also recommend using either the middle or the ring fingers. The reason for this is because these two fingers have the least amount of nerve endings, but also tend to bleed the best. In this instance, the patient insisted upon using her middle finger. So, take your alcohol swab and make sure to clean off the finger really well. If the patient has cold hands, you may want to warm them up a little bit to increase blood flow. you can just squeeze the finger and massage it a little bit. Another tip, have the patient shake out their arm. This will also increase blood flow and make it easier for a blood extraction. While the patient is shaking out her arm and letting the alcohol dry, you can get the machine ready. Turn it on and take out one of the cholesterol test strips. From here, you'll insert it directly into the machine with the circle side in first. You will also want to get all the other materials ready. You will need a cotton ball, a lancet, and a capillary tube. Now you are ready to take a blood sample. When preparing to give a sample, it's a good idea to grip the finger fairly tightly, the thumb on top and the other fingers wrapped around. Once you are in position, you can prepare to give the poke. Open the lancet, tell the patient to relax their arm, place the lancet in the middle of the finger. When giving a finger poke, you want the lancet to be slightly off center. Place the lancet firmly against the finger and deliver the click. A blood bubble will begin to form, and from here you can take your capillary tube and place it right next to the bubble. When collecting the blood, you may need to gently squeeze with your fingers to produce a bigger bubble. Be sure not to scrape against the skin, just hold the capillary tube right up next to the bubble. When collecting the blood, you want to make sure you go up to the black line. Put a cotton ball on the patient's finger and instruct them to pinch it. From there, take the blood sample that you acquired and put it directly into the CardioCheck machine. From here, it will take about 90 seconds to run for the results. Be sure to dispose the lancet into the sharps container. After the patient has applied pressure to the extraction site for about 1 minute, then you can cover the wound with a Band-Aid. Take the patient's finger, use the cotton ball to remove any excess blood. Next, throw the cotton ball into the biohazard bag and apply the Band-Aid to completely cover the wound. Next, you can remove your gloves. A good way to do this is to take them off one at a time and kind of wrap one inside the other, so you're only touching the inside of one glove. Put these in the biohazard bag as well. After about 90 seconds, the results will display on the CardioCheck machine. The results, in order, are total cholesterol, HDL cholesterol, and the total divided by HDL ratio. This concludes our review of a biometric screening at Healthy Hearts.